Good evening. Welcome to Left, Right and Centre. I'm Vishnu Shom. On the programme tonight, 4 weeks into Omicron, we are joined by Dr Angelique Coetzee, the physician who first detected Omicron in South Africa. Why is it that cases in South Africa are relatively mild while the United Kingdom prepares for a tidal wave? In both cases, a speedy rollout of boosters is key, but in India, we continue to delay. I'm also joined by Professor Lawrence Young, a leading virologist at the University of Warwick, and Dr Shashank Joshi of the Maharashtra Covid task force. Well, joining us now, Professor Lawrence Young. He's a virologist and professor of molecular oncology at Warwick Medical School. Thank you, Professor, very much for being with us. So many questions are being asked at this stage on the efficacy of boosters. Do we at this stage know what is the ideal booster combination to ensure that people get more antibodies against Omicron?
No, but we know that boosting, particularly with the RNA vaccines, works very effectively. So almost irrespective of what you've had for your first two jabs, a booster with RNA is where we have most data, but it's likely that any vaccine given as a third dose will provide a significant increase in protective immunity. The big question, of course, is what does this mean for the Omicron variant? All the indications from laboratory studies and from a few studies in boosted individuals is indicating that boosting should protect at least from severe disease,
right,
Omicron, if not from symptomatic disease. But actually the data is coming in all the time.
Professor Young, the reason I ask you this is because here in India, for millions across this country, we've got the AstraZeneca vaccine. It's called Covishield in India. It appears to work extremely well with 2 doses. And the question being asked now is, will a third dose as a booster be helpful? Why the same vaccine? Because mRNA vaccines like Pfizer and Moderna don't exist in India. They haven't been introduced. Hence the question, would a third dose of the existing AZ vaccine work as well?
Yeah, so I answered the question in relation to the data that we have where immune responses have been measured as a consequence of a third booster dose. It's very, very likely that any vaccine given a third time will provide significant protection, but we haven't got real world data on that. But my anticipation is, from everything we know about the immune response and we know about vaccination, is that even a third dose with AstraZeneca should be protective and should provide that high level immunity you need against what is a very, very infectious variant of coronavirus.
What about designer booster shots in the future designed to take on Omicron? Is that something that needs to be done faster?
Yeah, so I mean, I think the thing is this: what we're doing at the moment by using the current vaccines as booster shots is providing, if you like, quantity rather than quality. So this gives such an overwhelming antibody response. Also, it gives that very important T-cell response. But it's so overwhelming that even though these vaccines are based on the original Wuhan version of the virus, it's sufficient to give you protective immunity, at least in the short term. But it's quite clear that we're going to need modified vaccines in the future. These vaccines will not only be modified to include the variant changes, particularly in the spike protein, but also are likely to incorporate other bits of the coronavirus, perhaps to provide longer term, more cross-reactive protection in the future.
Professor, in the United Kingdom, Prime Minister Johnson yesterday said that there is a tidal wave of fresh infections which are coming the way of the United Kingdom. Are you already beginning to see serious hospitalization rates?
No, we're not seeing serious hospitalization rates, but we know from this virus that there's a lag between getting infected, getting sick, getting seriously ill, and then having to be hospitalized and sadly dying if as a consequence. And these can take 2 to 3 weeks. So what we're worried about, and we've seen in the last couple of weeks, a massive increase in Omicron, to the extent that almost 40% of cases, for instance, in London now, have gone from nothing 2 weeks ago. 40% of cases now are Omicron, and we're seeing that doubling every 2 to 3 days. So there is a significant wave, a tidal wave of infection. We're only starting to see hospitalizations now. So we just have to keep an eye on what's happening there.
Professor, wouldn't hospitalizations be inevitable, just given the numbers which are likely to take place because of greater transmissibility of this strain?
Absolutely. And even if you say a best case scenario is that Omicron is less severe in terms of disease than Delta, that won't matter because there are going to be so many people infected in this country. We believe that this will be more than 1 million cases by the end of December, that this will, even a small percentage of a large number getting into hospital will overwhelm our healthcare system.
And which really brings us to the key question: why hasn't the United Kingdom had a 100% masking up policy out several days back? I know that on public transport you've now said you have to mask up. I know that there are guidelines, for example, in universities for students to mask up. But why not everywhere, 100% mask utilization? Or is it possibly too late now?
Well, that's a very good question. I would have argued a month ago, because we've had very, very high levels of Delta infection anyway, and I would have argued a month ago that we should have brought in these extra protective measures. At the moment, we have a very confusing policy where from today, Monday, we're being asked to work from home where possible, but masking is still not required in every venue. Christmas parties are still being encouraged. This is a very, very difficult and mixed message, and I think we're going to need more stringent controls, and I anticipate that within a week or so, there will have to be more stringent controls.
A final question to you. Is there a silver lining in all of this? I know the data is still coming in, but we've seen the South African data now for more than 2 weeks. And there are indicators that the illness remains relatively mild over the large number of patients. Is that your sense now as well, based on the preliminary data you're seeing in the UK?
Well, it's too early to say in the UK, and I'm very cautious about what's coming out of South Africa for a number of reasons, not least the demographics are different there. They have a much younger population. They suffered a lot of infection, so there's people there with natural immunity, and even though they have relatively low levels of vaccination. So I'm still a bit concerned about this, but your point is valid. It could be, the hope is, that if Omicron is less virulent than Delta, then a wave of infection with this could wipe out Delta. It looks like Omicron will compete out Delta, and it may result in something that is a bit more positive than the current expectations, shall we say. At the moment, to be frank with you, what we're doing here is planning for the worst, but hoping for the best.
Yeah, well, let's hope that's good enough, not just in the United Kingdom, but increasingly in so many countries across the world. It's quite frightening. Professor Lawrence Young, thank you very much for speaking to us. Thank you very much.
Thank you. Thank you.
We're joined by Dr. Angelique Coetzee, who's chairperson of the South African Medical Association. Dr. Coetzee was the doctor who, during her practice, detected cases in Pretoria in South Africa, which she felt could be a potentially different strain. She brought to the world direct evidence of the possibility of a new strain. It turned out to be Omicron. Very privileged to once again be speaking to you, Dr. Coetzee. In the last couple of weeks, what are a couple of the trends that you are seeing? Is it now confirmed that this is less fatal? Is that a confirmation at this juncture?
Thank you for asking, and good afternoon to your viewers out there. From the primary health care side, yes, it's confirmed from our side that it's a mild disease, which don't need hospitalization for the majority of patients. However, we did see a slight increase in our hospitalization regarding unvaccinated people, around about 88% with COVID. Unfortunately, we're not sure whether it's Delta or Omicron for now. But at primary healthcare, it's mild. It doesn't matter who you ask, all our colleagues, all of us, the same. Even the hospital close to me the beds are sort of There's more than enough space. The only people who might have a problem is our public sector hospitals, but that's not due to COVID then. It's due to, there's a lot of people, car accidents, trauma that comes in, and those patients are then, when they are tested, are positive, but they're not there for primarily COVID.
Is there a worry that given the much, much higher transmissibility, hospitals may still be overwhelmed?
This is now our 4th week. If we look at what we have seen and compare it with Delta, during the 3rd week in Delta, we were already from SAMA's side urging the minister and president to please start closing the schools as well as gatherings. It was actually, within about 3 weeks, 10 days into the disease with Delta, we knew that we were in trouble. With this, in this case, we are now in our 4th week. We're not in trouble, not at all. We also, it seems, we might be wrong, but it seems that the cases in the epicenter, Gauteng, are very, very slowly rising. In fact, there was 1 or 2 days where the numbers actually went down. So it is spreading to the other provinces, which is expected, but still it's mild.
Doctor, this is a contrast to, say, what's happening in the United Kingdom, where yesterday Prime Minister Johnson has warned of a tidal surge, a tidal wave of COVID cases. Their hospitals are already seeing a big step up in cases. Would that suggest that the rate of community transmission in the United Kingdom is much more than what you're seeing in South Africa? And if that hypothesis is correct, is it because people mask up more in your country than, say, the United Kingdom?
That's a difficult question because I don't, look at their daily numbers. But I can't, for the life of myself, think that they will have a different Omicron viral infection than we have. So in the beginning, that first week, we were very concerned. We treated the patients as if that's a Delta. Remember, everyone was telling us about the mutations, and we were waiting for the cytokine storm to happen after about 10 to 12 days. So we were very much on high alert. But again, we didn't admit these patients. So it can be that some of the doctors feel that the patient might be admitted. But I can promise you, if it's the mild cases that we see, with it 2 to 3 days later, they will definitely discharge them. They won't stay there.
What about boosters, Doctor? What are the primary boosters that you have available, if any, in South Africa at this stage?
So we only started about 3 weeks ago with the Johnson & Johnson booster. And our government did announce that we will now start with Pfizer booster for us, especially the over 60s, so that they first get a booster dosage, and then you will go to 50 years and 40 and immune compromised. We also will get a guideline, hopefully within the next week or so, where the minister would announce, hopefully, that the children 12 and plus would get within 6 weeks after their first Pfizer, a second Pfizer. And that's the most important things that you from the government side can do to help and curb it.
Dr. Coetzee, I'm just trying to understand, is there any research out of South Africa which gives the extent to which 2 doses of the present vaccines are sort of have lower immunity among people who've got them after a period of time, and therefore these are the individuals who are much more vulnerable to Omicron?
So what we have seen is that, again, in the private sector or primary healthcare, that about, like this afternoon, I saw four patients in a row who had their Pfizer jabs. And if you ask the patient, when was your last jab? And the patient is anything between July and September, you have to test, because we do see the breakthrough infections on them, but it's mild, it's not severe. As far as we know, none of these patients has been admitted. As I have said earlier, the majority of patients admitted primarily for COVID
Right.
would be unvaccinated people, but it's not a lot. It's not a lot.
So
of people
that's
admitted.
important. The vaccines, the existing vaccines are protecting people even against Omicron. To what percentage are you able to determine, or is that it's too early?
So in again in the unvaccinated and severe disease and hospitalization, for now the data that we have is around about 88% of people in the ICU with COVID, primarily COVID, are unvaccinated.
Right.
So that will give you an idea. And then at cold phase, at the primary healthcare, it's about 50-50, but it's not only vaccinated. We even see people who had COVID before and then get COVID again. So it's breakthrough infections. It is vaccinated people getting their infections. It is, I had COVID, then I vaccinated, still get the infection, but it's mild. The other thing that is important that we have seen now, we actually started to pick up on it last week, or to notice it since last week, is that certain people unvaccinated, remember this gives you quite a nice headache with body aches and pains or myalgia, and the tiredness. So we have noticed that quite a lot of the unvaccinated people will have, I call it the mother of all headaches. They experience their mild symptoms of headache, body aches and pain and tiredness much more intense than we have seen with the vaccinated people of all ages.
Right. And a final question to you, Doctor. With the booster, are you able to determine the extent to which antibodies are boosted? So are you, for example, as the research in the United Kingdom suggests, are you getting protection against Omicron of 75% plus with a Pfizer booster? Is that the expectation?
So remember, we haven't started yet with the Pfizer booster. We are going to start. But if they look at the data, that's more or less what's been said. Again, the data on your Pfizer shows that there's waning of the efficacy after about 3 to 4 months. It starts to wane, and this is exactly what we are seeing with the mild disease. Thank heavens we are seeing Omicron as a mild disease. We would have been, however, in trouble if Omicron was a severe disease, because we don't really know how protective it is against severe disease. For now, that's not the majority of people in the hospitals, but we don't have a high enough number in the hospitals to say, okay, Omicron is behaving like this. And again, at this stage, we still see a Delta, and unfortunately, the labs do not distinguish between the patients in ICU, whether it's Delta or Omicron.
Right. And
it's difficult because it's a respiratory disease at that stage to determine. For us, it's easy. It's a clinical picture. This clinical picture for the last 4 weeks didn't change at all. It stays exactly the same.
Right.
And the recovery rate of the patient stays more or less the same, 5 days. But I must say that we also prescribe cortisone early in the disease here, where in Delta you waited till at least 5 days, or when the cytokine storm starts. Here we just do it the other way around. It's very interesting. And then you don't need to go to give high doses of cortisone. So if I make the diagnosis today, I will start for 5 days with very low doses of cortisone, and you use something like ibuprofen and Panado combination. It works. That is a very well-trusted combination at this stage. So we don't even prescribe, there's no antibiotics that we prescribe. There's not a lot of other disease medication. It's the basic things, and our patients get better.
Just a final question, Doctor. Again, I'm trying to understand, we are seeing massive community transmission in the United Kingdom and in Denmark. Does the age profile in these countries have something to do with the greater vulnerability of their population as compared to South Africa, where, as I understand it, your population is younger, by and large, and therefore stronger perhaps? Antibodies may be more effective.
It might be. It would be interesting to see the data as it comes, being distributed from England. But remember, our people, even though they're younger, they're not very keen to get vaccinated.
Right.
You know, that's all my rights and you know, why should someone tell me to get vaccinated? Well, our 60 plus, more than 65% has been vaccinated.
Right. Well, Dr. Coetzee, that's wonderful speaking to you. Here in India, we really do need to start getting our booster dose rollout. Hopefully that should happen sooner than later. Certainly the South African example of the rollout of booster doses and how that's helping in the fight is a lesson we need to take. Thank you very much, Angelique Coetzee, for being with us.
Thank you so much. Thank you so much, and please stay safe.
Joining us now, Dr. Shashank Joshi. Sir, thanks very much for being with us. It's been a couple of weeks now since the world is coming to grips with Omicron. We are seeing this potential tidal wave in the United Kingdom. How worried are you about India?
So clearly we have 3 countries with community transmission: South Africa, United Kingdom and Denmark. And we are seeing exponential rises in numbers, but the cases are mild and we have not reported severe disease. Of course, there is occasional death which is reported. If currently all the outbreaks in India are sporadic and travel related, but that doesn't mean that we let our guard down. We have to be very, very vigilant, because particularly with the holiday and festive season being around, we cannot afford to have a community outbreak or a cluster outbreak, and that is what we need to contain. What is also going to be very interesting is how the Delta will pan in versus the current Omicron in India will be very interesting to note.
Dr. Joshi, boosters. Now, it appears that the Serum Institute's initial application to roll out Covishield as a booster hasn't immediately been accepted. Instead, they've been told, please carry on with trials. Considering the fact that there are no other vaccines per se which are available, for example, mRNA vaccines are not there presently in India, are we not just delaying the inevitable? We have to have Covishield as a booster at some stage. Sooner, better than later would be ideal. And the same for Covaxin?
So I think in India, the science on boosters has been poor. The right science is to do mix and match. We need to do appropriate trials for the same. Having said that, one needs to at least look at 2 groups which needs a booster or additional dose strategy. Number 1 is people who are recurrently exposed, like frontline workers or healthcare workers. And secondly, people who have diseases which lead to immunocompromised states and they cannot mount an antibody response. In both these categories, an additional dose to booster dose, apart from children, definitely need a vaccination strategy in place. And appropriate science in India needs to be generated so that a correct strategy is adopted.
No, but sir, when we talk about appropriate strategy, Dr. Joshi, when we talk about appropriate strategy and we talk about trials, which is an ideal scenario, this is a process which could take 6, 7, 8 months. We don't have the luxury of time. Omicron is upon us. Now, if this vaccine is not hurting us, and it is no one's contention that it is, then why not roll this out?
So there are 2 things. This was based on the hypothesis that there is hybrid immunity. So I think at least in people who have not suffered from COVID and have finished their 2 doses and they are in the immunocompromised or the healthcare space, I think they should at least be offered an additional dose to a booster dose. So I don't see major challenges with that. Secondly, a mix and match strategy can be adopted, or at least we can have a larger pragmatic, adaptive clinical trial program in the healthcare space in the booster strategy. At least that can be initiated. So I'm totally for it, but I think the lack of Indian data has been the primary reason for the delay, apart from vaccine equity.
All right, Dr. Joshi, thanks very much for being with us this evening. Thanks very much indeed.